Can a pancreas MRI tell if a lesion is cancer? Imagine trying to solve a puzzle where some pieces look very similar. That's often what doctors face when they look at pancreatic lesions on an MRI. MRI, or magnetic resonance imaging, is a powerful tool that creates detailed pictures of the pancreas and surrounding tissues. It uses magnetic fields and radio waves to produce images without exposing you to radiation. When it comes to pancreatic cancer, MRI can be very helpful in spotting small tumors and understanding their location and size. It can also show how the lesion looks compared to normal tissue, which can give clues about whether it might be cancerous. MRI can detect pancreatic lesions with high sensitivity, meaning it's good at finding even tiny abnormalities. Its ability to differentiate between benign and malignant lesions is also quite strong, thanks to specific imaging features. For example, cancerous areas often appear darker on T when weighted images and brighter or similar in brightness on T to weighted images. After contrast dye is injected, tumors may show characteristic patterns, such as less early enhancement and more gradual late enhancement. Additionally, a special MRI technique called magnetic resonance cholangiopancreatography, or MRCP, can visualize the pancreatic and bile ducts clearly, helping to identify tumors that block or affect these structures. However, even with these advanced imaging features, MRI cannot definitively say if a lesion is cancer. Sometimes benign conditions like cysts or inflammation can look very similar to cancer on MRI scans. Because of this overlap, doctors usually need more information to confirm a diagnosis. The most reliable method is a tissue sample, or biopsy, which can be obtained through procedures like endoscopic ultrasound-guided fine needle aspiration. This allows a pathologist to examine the tissue under a microscope and confirm whether cancer cells are present. In clinical practice, MRI is often part of a broader diagnostic process. It works alongside other imaging tests like computed tomography scans, endoscopic ultrasound, and sometimes positron emission tomography scans. These combined approaches help doctors get a complete picture of the lesion's nature, stage, and whether surgery might be an option. MRI is especially useful because it can detect small tumors early and help plan treatment by showing the extent of the disease and any spread to nearby tissues or lymph nodes. In summary, a pancreas MRI can strongly suggest whether a lesion might be cancerous by revealing specific imaging features and patterns. But it cannot alone provide a final diagnosis. Confirming cancer usually requires a biopsy or additional tests, along with clinical evaluation. MRI remains a vital part of the diagnostic toolkit for pancreatic health, helping doctors detect and evaluate potential cancers early and accurately. If you or someone you know has a pancreatic lesion, it's important to work closely with healthcare professionals who can interpret these images in the context of overall health and symptoms.